Hello, this is Ron Paul with your weekly update for May 31st. Most everyone agrees that healthcare in the United States has major problems, the biggest problems relating to skyrocketing costs. No one doubts the system is in need of reform. However, too many in Washington see tighter government controls as the solution. In fact, the problems are rooted in past government controls that created more problems than they solved. Ironically, laws and policies in the 1970s promoting health maintenance organizations resulted from desperate attempts to control spiraling costs. However, instead of promoting an efficient healthcare system, HMOs took far too much control away from patients and physicians and gave it to the insurers. This excessive reliance on third-party payers instead removed incentives for insured patients to economize on healthcare costs and allowed the problem to snowball. Furthermore, the third-party payer system created a two-tiered healthcare system where people whose employers could afford to offer Cadillac plans have access to top-quality healthcare, while others face financial obstacles in obtaining quality healthcare. For these and other reasons, I introduced the Private Option Healthcare Act last week. This bill places individuals back in control of healthcare by replacing the recently passed tax, ban, and regulate healthcare law with reforms designed to restore a free market healthcare system. First, the bill would provide all Americans with a tax credit for 100% of healthcare expenses. This tax is fully refundable against both income and payroll taxes. It would also allow individuals to roll over unused amounts in cafeteria plans and flexible savings accounts. Next, it would provide a tax credit for premiums for high-deductible insurance policies connected with a health savings account and allow seniors to use funds in HSAs to pay for Medigap policies. In addition, it would repeal the 7.5% threshold for the deduction of medical expenses and thus make all medical expenses tax deductible. The Private Option Healthcare Act allows Congress to correct the mistake it made last month by replacing the new health care law with health care measures that give control to individuals instead of the federal government and corporations. Our health is too vital to allow for the typical results of government interference and fixes. Thanks for calling this update. New update is placed on this number, 888-322-1414, every Monday. The written text can be found on my website, www.house.gov/Paul, under the heading Texas Straight Talk. Thanks for calling.